The journey of a provider starts with credentialing. When a provider has to get a contract with a payer, certain information needs to be shared as part of this process. Automating these tasks can save valuable provider time. The second step is to either build or buy a system or a set of systems to manage the patient's health record, revenue cycle, and operational aspects of the practice. Product engineering from a trusted solutions partner will help in this stage. The next step after the implementation of these systems is the migration of data from any past systems or sources that the provider may have used. This is solved using data migration and implementing pre-approved communication standards like FHIR and HL7. After the systems have the data from historical sources, the next need is to integrate with partners such as clearinghouses, ERX prescription providers, revenue cycle systems, and any other third-party systems that the provider may want to use. This requires intricate knowledge of various interoperability standards such as HL7, EDI, FHIR, DICOM, and so on. Once the systems have been integrated, the provider starts using these in order to create care services for the patient population, such as appointment scheduling, registration check, ineligibility checks, and so on. RPA and healthcare software development together can act as a virtual employee for the providers, in turn minimizing operational expenses and expensive errors. The huge number of resources are used by the providers to deliver care to the patient either within their premises or in a remote facility such as an SNF or a patient-centered medical home or at the patient's home. These require quite a lot of coordination amongst the provider staff. Once again, a bit of software development with informative dashboards coupled with a dash of RPA can make these processes easy. Every provider organization has to go through tremendous amounts of effort to get the right reimbursements from the payers. This involves processes related to the claims management lifecycle. This entire effort is highly manual, error-prone, and has a vast amount of impact on the profitability of the provider. RCM software integrated with RPA can help providers automate this process to maximize their investments. The value-based care model has prompted providers to ensure that the patients are conscious about their health and mental well-being even when outside premises of the provider. To achieve this, they need a mechanism to track the patients throughout their life cycle and the ability to intervene when events of interest happen. RCM solutions coupled with PHM solutions are the key to maintaining patient well-being. Along with delivering value-based care to patients and implementing the revenue cycle, providers need to adhere to certain compliances. These regulatory measures have been put in place by the CMS to ensure that patients and the right interested parties have access to patient information whenever needed. The availability of qualified and competent technical staff is becoming a scarcity. Healthcare facilities have numerous processes like clinical, financial, and operational. These can be automated to save valuable provider time. Vast amounts of data is generated across the different processes within a provider facility. To make sense of this data, it is aggregated from various sources and built into meaningful reports and dashboards. In order for the providers to operate in the ecosystem, there is a constant need to share data with different partners. The information flowing between these partners needs to be accurate and also adhere to certain standards. Finally, often with time, providers feel the need to add new systems to their landscape or migrate away from existing systems which are no longer relevant. Modernization is not a process with a single solution. Starting from software development to implementation services, migration from legacy systems, and integration with the current, all of it is necessary to navigate this stage with ease. If you are currently in any of the stages, we can help you build a system that is up to date, compliant, and helps you deliver quality care. With over 120,000 clinicians enabled, we are one of the most trusted solution partners around the country. Connect with us or check out our services from the link.